Hi there. I'm Lauren Murphy. I'm one of the physicians here at Boston IVF. I'm here to talk to you today about coming back to treatment. You have already made the hardest step in the process, which is making a first appointment and coming in to find out about fertility and fertility treatment. Here at Boston IVF, we know that this is a challenging time for you, a challenging process. We know that it is stressful and often filled with all kinds of other emotions as you establish care with a fertility specialist. But I want to be here to tell you that it doesn't have to be scary. I want you to feel supported in this process as we go. So what might that look like for you if you were to come back? If you come back for treatment, we are going to walk you through this process step by step. We are going to hold your hand as we make appointments for testing, which might include things like the hysterosalpingogram, that long expanded name that's sort of complicated and confusing. We call it the HSG. We will support you as you go through that testing. We will help you schedule your initial blood work. We'll help your partner come in to schedule any testing that they may need to do along with you. And then we're going to schedule a follow-up appointment to walk through those tests one by one and give you a really clear picture about what's going on with you and your fertility. And while I completely recognize that that may feel overwhelming for you, I want you to know that unpacking the unknown and clarifying the picture for you also is empowering. And what it allows us to do as physicians here at Boston IVF is to put together a really intricate treatment plan that's specialized for you and only you in your particular scenario to best help you achieve success with your fertility treatment. I know that when I talk to my patients, I think one of the biggest fears that patients have about doing this testing is the fear of the unknown. What is it going to show? But what I want you to know is that the vast majority of patients that walk through our doors will walk out successful. And that is a critical piece of this puzzle. So whether your journey here with us is really short or whether it is a long one, we are going to be here with you each step of the way to help you understand what that process looks like, to strive for excellence and success with each next step, to be here for you through a really challenging time, but hopefully a really positive and hopeful experience for you. So my best recommendation is to call us back. Give us a call. Reach back out to your nurse, reach back out to our administration to help you book a follow-up appointment. We could even have an initial or repeat an initial consultation with you if you want to walk through those tests again before you do them. But I think the message here is that the longer that you wait, I think the harder it is to jump back in. And with waiting also comes potential challenges. Whether that be personal fatigue in terms of the process of trying, the emotional exhaustion that can sometimes come with that. We find that the sooner you come to treatment, the better we can be at being proactive as opposed to being reactionary and finding that we need to do maybe more than we would have needed to do if you came back sooner. So please pick up the phone, give us a call, let us be there to help you. The outlook is really bright, okay? The outlook is positive. The options are many, and we'll be able to talk with you about that so much better if you come back and we start the process.